Vocal fatigue, causes and prevention. Vocal fatigue is a general term that describes strain, tiredness, or weakness in your voice. A simple definition of any type of muscular fatigue is that your muscles are running out of fuel faster than you can replace it. Anyone who places heavy demand on their voice can experience vocal fatigue. Not only singers, but teachers, actors, and interpreters who spend many hours in a courtroom or in a medical setting may feel this. Strictly speaking, our voices don't tire. Voice, after all, is air from the lungs chopped and shaped and carried in waves to the listener's ear. Our structures that create the voice, however, can tire, working effectively or become damaged from overuse. Symptoms may include dry mouth, a need to clear your throat, hoarseness, scratchy or raw feeling, achy feeling in your neck, feeling winded, a general feeling of weakness when speaking, frequent breath or running out of breath, reduced volume on high or low pitches, tension in the neck, shoulders, and upper chest. Right now, science can provide no magic number for recovery time needed to overcome vocal wear and tear. Are your vocal muscles tired? Infrequent or hard exercise makes our muscles ache. The same goes for muscles required for voice. The muscles around the ribs and abdomen expand and contract to provide breath for speaking. Loud or excessive talking may make these muscles tired. Some people then fall into the unhealthy habit of overusing muscles of the neck to push the voice. These little muscles can't fully and consistently do the work of the big muscles of the abdomen and rib areas. Thus, the neck muscles are worn out before the interpreting day is over. What causes vocal fatigue? Vocal fatigue can be caused by medical problems with your voice or by the way you are using your voice, bad habits, or poor technique. Additionally, fatigue can become a vicious cycle since overstraining may occur in an attempt to compensate for the fatigue. Should I worry about vocal fatigue? Strenuous exercises fatigues your muscles. However, the duration of the fatigue and recovery time depends on your level of training and physical fitness. The same principles apply to voice use. Speaking involves the entire body and psyche, meaning vocal fatigue is unavoidable sometimes. If there is a reasonable explanation for your fatigue, you might not worry about it in the first instance. However, repeated bouts or a voice that becomes tired after only a short period might indicate abnormal vocal fatigue. Preventing vocal fatigue. Prevention is always better than cure when it comes to any form of muscular fatigue. Most importantly, you should recognize the signs of vocal fatigue and be proactive to address them before it becomes a problem. To prevent vocal fatigue, avoid vocally abuse behaviors such as persistent throat clearing, coughing, yelling, or prolonged loud talking. Monotone speaking and keeping your voice down in a croaky place. By continuously varying the pitch and volume of your voice, you distribute the vocal load more evenly across the entire mechanism. Speak in environments that are dry, smoky, or excessively air-conditioned. These environments will tend to irritate the mucous membranes of your throat and reduce your vocal stamina. Noisy environments cause you to increase your vocal effort and volume in an attempt to lift your voice above the noise, a phenomenon known as the Lombard effect. Vocal stamina is a reflection of your body's general health, which comes down to four key factors: sleep, diet, hydration, and exercise. Above all, people who place heavy demands on their voice need ample rest, as your body regenerates cells faster and more effectively during sleep. Hydration. Regular intake of fluids is also essential for peak performance. Generally, pale urine during your waking hours is a good indicator that you are maintaining adequate hydration. Additionally, wet snacks such as watermelon, pineapple, strawberries, and stone fruits can help with hydrating your body. Furthermore, humidifiers and steamers will help to soothe a fatigued voice by providing environmental hydration. Vocal naps. A vocal nap is a short period of voice rest from 5 to 20 minutes. Throughout your working day, try to vary your workload so you can find short periods of vocal rest, and so that you don't do all your vocal intensive work in one short period. Likewise, try to make effective use of break times by resting your voice. Singing lessons. A good voice coach can help you prevent fatigue by building your vocal technique. With proper functional voice training, you can increase your vocal strength and stamina, preventing common causes of fatigue. Some important techniques are strength in the chest voice and even closer of the vocal folds to ensure your voice is not breathy. A sound that has a sense of connection and support from your body. Breath management. Supportive posture. Clean onsets so you don't start phrases with a breathy tone or with a heart attack. Flexibility so that you can vary your vocal range and intonation. All professional voice users need to know how to warm up their voice effectively. A good voice coach can help you develop a warm-up tailored to your needs. Research has shown that interpreters who warm up report fewer instances of vocal fatigue and recover more quickly from heavy voice use. Vocal hygiene. Besides vocal pacing, you must also practice good voice hygiene. These strategies help keep the throat moist and free from irritation, so the vocal cords are less likely to be injured. Drink 64 ounces of water or non-caffeinated liquid during the day. Keep water at your workstation. Avoid caffeine and alcohol, which are drying to the throat. Avoid excess coughing and throat clearing. Don't smoke. Smoking causes irritation and can lead to cancer. Don't work on the phone if you are hoarse due to a cold or upper respiratory infection. Work with your doctor to manage any medical condition that can cause throat irritation, including acid reflux, postnasal drainage, allergies, asthma, and endocrine conditions. Voice problems as we age. As we get older, our voices change. Some of this stems from other aging-related processes. We lose muscle mass, our mucous membranes thin and becomes drier, our lung capacity lessens, and we lose some of our fine muscle coordination. Changes can also occur in the voice box, such as vocal cord atrophy or bowing. Changes in the voice as we age can include higher pitch in men, lower pitch in women, reduced volume or projection of the voice, reduced vocal stamina, tremor or shakiness of the voice. Professional help. Interpreters must learn to recognize the difference between when they have worked their voice hard and when they have fatigued their voice. Likewise, do not ignore ongoing issues with fatigue, as it might be a sign of a more severe problem with your voice. If your voice doesn't feel right, give it a break. Then, see your doctor if your voice doesn't start to feel better after a few days of rest. Vocal fatigue that persists for several weeks should be investigated by a voice therapist or doctor to ensure that there are no medical problems. Chronic voice problems may need treatment. Specialist treatment can include medication, surgery, voice therapy, or a combination of these. Every professional voice user should be aware of a local music therapist, speech pathologist, or laryngologist who is skilled in working with voice problems.